Well, hello and welcome to the 27th Degree with Chris and Nancy. So our guest today is my good friend, Dr. Rajiv Nehra, who is joining us today to discuss CBD. Before we begin our conversation, I'd like to thank our sponsor, Bay Coast Bank. Bay Coast Bank is just right for all of your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. As always, you can support the 27th Degree with Chris and Nancy by subscribing to us on YouTube or your favorite podcast platform, and by following us on Facebook and Instagram. Also, please remember to leave a review. 5-star reviews, of course, are greatly appreciated. Well, great. I'm so glad to have you here.
Thank you for having me. I really appreciate the opportunity.
You're very welcome.
I'm happy to be here.
It'll be a wonderful conversation, I'm sure. I mean, we're both very excited about CBD, so.
We are, yes.
There's a lot we can talk about.
So now you guys started Advanced Medical with the CBD products. Can you just talk a little bit how you got into that and talk about CBD in general?
Well, I think we both had different experiences, but why don't you start with your experience? And
I think it was over 3 years ago, and I was treating patients, and I said, sometimes what we do is just not enough, and is there something that we can utilize in a very non-invasive approach that can complement other means of management, whether it's medical management, medications, therapies, modalities? Is there something else that our patients can utilize to give them a higher outcome? And I looked into it, and through other patients saying, look, I've tried this and it's helped me, then I started to move forward to say, hey, what's this all about? And it started down south, with these pain management programs where they themselves were trying to incorporate another ancillary means in which they can provide somewhat of an alternative approach to help these patients get a higher outcome. And I started slowly providing it for patients that gave me audience to say, look, it's CBD. And it may help you with your pain. It's CBD. It may help you with your inflammation. It may help us complement your low back or your sciatica. And over the course of time, we were getting great results. And then further and further, I spoke with other primary care doctors, Dr. Jonkis being one of them, and said, let's see what this can do for our community. And more importantly, our patients, that we're not saying don't do what you're currently doing, but see if we add this and you're able to get a little relief. And that's the end goal. If we can lower the volume of this bad song that you're experiencing on a day-to-day, and you've tried many other sources and you get benefit, what have you lost? And I think, Dr. Jonkis, you can agree with me.
Right. I mean, we both deal with patients with pain issues. I'm an internist, you're a chiropractor, but we all have we have similar patients. I send a lot of patients for chiropractic care who have, low back issues, and, musculoskeletal problems, whatnot. I think for me, it was somewhat similar to what you experienced, and maybe a little bit different in that, I have some patients that I've taken care of for many years who are out of necessity on opioids, and I prescribe those opioids. And, it's something that we don't do lightly. We know about the opioid crisis. We know that there are side effects. We know that patients have bad outcomes long-term with opioids. But that being said, some patients need opioids because they have terrible pain and their quality of life is adversely affected. But I was looking for something else. And I got to be honest, I was very skeptical about the whole medical marijuana. And, a few years ago, all of a sudden, all these, dispensaries are popping up all over the place. And I haven't seen the statistics to know how much of that is medical versus recreational, but I think a lot of it is probably recreational,
and
quite
I don't
honestly.
disagree. And that's why you and I made the decision to say, CBD is a
Yeah.
good option where you're
So-
not getting any of that recreational approach. It's
Yeah.
purely for medical purposes.
Right. So what happened with me is, I was very skeptical about the whole thing. I really didn't. I mean, people were using it, but I thought it was more recreational. But then I had some patients who had been on long-term opioids who, on their own, had tried either CBD or had gone to a dispensary and bought a product, and they truly felt that it was helping their pain. And some of these patients actually had decreased on their own their opioids. And I
It's an
can
organic
say
change.
it's the first time I'd ever seen that happen in 20-something years of practice. No one ever, hardly ever, on their own with a chronic pain issue, it decreases the medication. And the reason for that is we know that we build up tolerance to these medications. So in fact, over time, we generally need more opioids once we are on chronic opioid therapy. But there were some patients who were able to decrease their therapy. And maybe they didn't get off it completely, but they decreased the amount. And I thought that was really, really remarkable because I'd never seen that before.
And then once they start to experience these benefits, they're even more motivated to continue and see what else they can do. So it's almost like a positive feedback system where, we're giving them other opportunities and other approaches to have a higher quality of life.
Right. And so for me, though, I wanted to do something other than medical marijuana because I wasn't really clear. And even after my research, I'm not 100% clear. And there will be people who will very strongly disagree with this. But I'm not clear that the THC is really necessary for pain control. And, there are people who believe that there's this entourage effect and a little bit of CBD and a little THC and a little bit of this and that all together has more an effect than the chemicals in isolation. And there may be some truth to that with certain patients. I mean, every patient is unique. But I think a lot of patients were deriving benefit probably from the CBD.
And that's why you and I made a decision
Exactly.
to let's exclusively utilize the CBD approach
Right.
and see if, in fact, in and in itself, it is getting us the results we need independent of the THC. So we don't have to get or discuss, is there euphoria? Is there any psychotropic events that may be occurring?
Right.
Are there any, hallucinations or anything
Right.
like that?
It's
We didn't
truly-
have to carry those conversations on.
Right. It's nice because it's benign. It doesn't have those psychoactive effects. You don't have to worry about, someone getting behind the wheel of a car and getting into an accident, God forbid, or hurting themselves.
But we do, for me, when I'm talking or discussing it with the patient, even though in fact we know
Right.
the risk is minimal, I always tell them,
course.
I always give them the precautions. And
we have to
moreover,
be cautious.
I always strongly encourage that they have conversations with their
course.
primary care provider to say, look, you have this ailment, you have this pathology, you have this condition. I'm suggesting, I'm introducing, but before you make any decision, talk to your primary care doctor. And you'll be surprised. They themselves may not know of the opportunity where it can provide some inherent benefit. And they may evoke a conversation with myself or some other resource to say, okay, I don't know. Let's try just the CBD in itself. Let's try it for a month. Let's try it forever
Right.
window of time. And if it helps, we can. It evokes further opportunities. And you'll be surprised with one primary care doctor that saw one patient benefit. Fast forward weeks thereafter, he or she is sending us other patients for that same reason to say, hey, it helped one person. Let's see if, in fact, because they themselves are seeking other resources to help
Of course.
on the pretext it's not creating any severe adverse effects that we've already discussed.
And I want to just mention, kind of along the same lines as what you've mentioned, for those who are watching this, realize this is for informational purposes. Every patient is unique. Every patient has unique medical issues and potential interactions with medications. Always discuss with your doctor or your healthcare provider whether or not this is right for you. And that goes for anything we discuss on these shows. Right?
Absolutely.
So can I ask you to back up just a little
Sure.
bit? We threw out CBD and THC. Can we kind of have a little discussion just
Sure.
to differentiate that and talk about that?
Sure. Yeah. Do you want me to take
ahead,
this?
yeah.
Okay. So I found a quote today, which I thought was great, and I really can't speak as eloquently as basically what this person did in discussing about the endocannabinoid system. So I want to talk about that. So this all comes down to the endocannabinoid system. Okay, that's an important term. So what?
By the way, when we went to school, we didn't know about these receptors in the brain and the periphery.
Well,
I mean, science is great.
Yeah, we didn't learn about this in medical school or chiropractic school because it didn't really exist at that time. It existed, but it was not known. But just as we have an endocrine system and a cardiovascular system and a pulmonary system and a renal system, this is another system that, although it has been known that these chemicals help with pain issues, among other problems, for many, many years, the endocannabinoid system is fairly new to medical science. So what is it? So the endocannabinoid system is a widespread neuromodulatory system that plays an important role in central nervous system development, synaptic plasticity, and response to endogenous and environmental insults. So what does that mean? It means that basically there are receptors in our nervous system. We know that, right? There are receptors that
in our brain and our periphery.
In our brain and our periphery. These chemicals interact with those receptors in a way. The ultimate upshot is that it can help with some of the dysfunction that can occur. And that dysfunction can lead to pain. It can lead to anxiety. Inflammation. That's where CBD comes in, or the endocannabinoid system comes in. So you asked about THC. Okay. THC is tetrahydrocannabinol. Okay. This is the active ingredient, the most important ingredient in marijuana. Okay. It's at a high level in marijuana. CBD, cannabidiol, is in a lower level in marijuana. So if you take marijuana, you're going to get a lot of THC, not a lot of CBD. And there are variations with marijuana. I mean, this is all genetically modified now. So you can actually grow marijuana that has a lot more CBD than it used to. But for the most part.
Do we want to say cannabis versus hemp or?
Well, that's what I'm going to get into now. So that's marijuana. Okay? In general, it's a big generalization. In general, THC rich, CBD less so. Now, hemp, which is a sister plant to marijuana. If you look at a hemp plant and a marijuana plant, they look very similar, right? But people don't smoke hemp to get high because it doesn't really have a lot of THC. But what it does have is a lot of CBD, cannabidiol. So it's kind of flipped. Okay. And the cannabidiol is what we're talking about, the CBD or cannabidiol, because that's what we find has been helpful with patients with a number of ailments. And it doesn't have that psychoactive effect that THC has, which is in marijuana mostly. And that's the chemical that causes that high. You know, we don't want patients to necessarily be high from the products we give them. We want them to have pain relief or maybe control their anxiety. There are a number of things that we use CBD for, right? And once again, this is all just informational, and you need to talk to your doctor before starting any therapy. But the point being that the nice thing about CBD, it's found in very high amounts in hemp. It doesn't cause those psychoactive effects that THC does, which is, once again, the main component in marijuana. And hemp is federally legal.
Right.
It's legal from the Farm Bill that passed, 3-4 years ago or so.
And to your point, there is no addictive property to both
that was one of my
THC
questions.
and CBD.
Right. Nice.
I mean, one, you wake up in the morning, I don't know what that's called, but it's the good feeling you may be addicted to, but there is no chemical addictive properties that if we wanted to stop it tomorrow, there's no receptors that require the need to it. And secondly, there is no the part of the brain in which produces the opportunity to stop your breathing or overdose.
Right.
CBD and THC cannot penetrate. It does not penetrate any element where you cannot overdose or become addicted to those two elements.
And that's an important point. So, with alcohol, with opioids, I mean, we all know what the long-term effects of that are. Right. People can become addicted. They can have long-term health effects. Now, I will say there are people who are daily users of marijuana who use a lot of THC, so to speak, and although they won't withdraw necessarily if they stop it, as one would with an opioid or alcohol, there can be some psychological component.
Right. I mean, you're addicted to the good feeling or to whatever that
but
sensation provides.
I don't think there's
disagree.
a physiologic addiction where they're going to go through withdrawal. But clearly there are people who use this daily who develop some form of addiction.
I don't disagree.
So then if I'm in recovery, say, I'm not going to worry about this for any addictive qualities or anything like that.
So not with CBD.
Here's my personal approach.
Okay.
If I do have a patient that is in recovery, I have to invite the conversation. So for those people, I don't invite the conversation. Hey, why don't you try CBD in terms of any gummies or tinctures or the like? I may suggest something of a cream if they're having joint pain or something like that. For what reason? I just don't.
It's not in your comfort zone.
It's not in my comfort zone. I think the research is out there for now that, again, there is no addictive property. But you know what? I just rather remove that from that conversation and let's talk about other variables.
We're very conservative, basically.
Yes. Personally, in my practice, there are patients who are in recovery, and I just don't. It's not part of the conversation.
I mean, I haven't seen issues personally with CBD with patients who've been on, like I said, long-term opioids, or maybe even had some issues with drugs or alcohol in the past. But you do have to take caution. And once again, this is something you always want to discuss with your healthcare provider because every patient is very unique.
I agree.
So now you mentioned creams and gummies. What other forms of CBD are there?
So our most common are the gummies.
Yeah.
It's easily accessible. You can put it in your pocketbook if you're taking it, once or twice in the day. So it's a very convenient form of utilizing CBD.
Right.
We have the tinctures that it's highly recommended right before you go to bed. So for those that are on a regimental, like once a day, they may take 1 milligram. They take it typically right before they typically take it right before they go to bed. But we have a lot of athletes that use the cream. We have people with joint pain, they use the cream. So predominantly, it's the gummies that we recommend. That's easy accessible. It's easy. It tastes great. You don't have that flavor to it. So people gravitate to the gummies.
I'll give you my approach. So it's pretty similar. But if someone has a localized pain issue, one joint, and they have a bad knee, I'll recommend something topical.
Yeah.
Because it's one area, you can rub it on, it gets absorbed through the skin. If they have, issues with, maybe multiple joints, then I talk to them about gummies or the tincture. Some of the people have isolated pain issues in one area. They will use a topical, but still use gummies in conjunction or the tincture, and that's fine too. I like the tinctures because you get a lot more CBD.
That's a good point, too, that you just brought up. It's not just because you use one, it doesn't exclude you from using the other. You can use them in
people
combination.
Use all three at times, and that's not atypical. But the tinctures are nice in that the concentration of CBD is higher. The downside of the tincture is that it's not as flavorful as the gummy.
So the tincture is a liquid, and how do you take it?
So it's like an eyedropper.
It's like a little eyedropper.
So you have a little bottle, it's 30 mLs, and the general dose is usually about 1 ml a day. So it's one dropper full. I have people start off at a half a dropper full, kind of build up.
And just under your tongue.
Under your tongue.
Yep, and it gets absorbed. And you end up swallowing a good amount of it too. But it doesn't, it's not flavorful like the gummies. The gummies are tasty, but the gummies have less CBD. And you also, you're getting some sugar there and some calories, which you probably, some people are, may not want that.
10 calories? Is it a little bit more?
No,
you're not going to blow my diet, right?
You're not going to blow your diet on it, but it's just some people are very particular about that, and there's a consideration. So some people have some systemic conditions. Let's just say that they have rheumatoid arthritis or something of that, and they're on medical management, but they may incorporate the tincture right before they go to bed or something like that. And again, it's just another ancillary approach to help them with their chronic pain. And
it becomes almost routine. Every night right before they go to bed, they just take it every day, and it just increases their quality of life. Better to than not to. That's the argument one can make.
So if I'm in pain, how come I'm taking it before I go to bed? Is that the most common? When I go to bed, I'm going to go to sleep and not feel the pain. So how long does it last?
It can last up to 24 hours. It's just, during the day, you may be eating something, it could be diluted. But, we just try to make it a routine that right before you go to bed, it's simple, it's easy, take it. And we're just trying to create routine habits.
There's nothing wrong with taking it in the morning either. You could do either way. But, a lot of times patients are taking other medications in the morning, and, it's a lot more complex. And at night it might be simpler. But you can take it in the morning. There's nothing wrong with that. You can take it midday if you want. There's nothing wrong with that either.
So we talked about a few things like arthritis and everything else. Can we just say, so for the creams, we're looking at, you said localized pain issues basically
approach.
For the cream, like arthritis, like joint pain.
Let's say you have knee pain. A lot of patients have used it. For a while, all of a sudden, a lot of golfers were using it. Maybe they had, some epicondylitis or some shoulder bursitis. Again, when I recommend it, as does Dr. John, because we never say it's the cure-all.
Right.
We say, if I take a stroke off your game because you're in less pain, there's the value of what this can provide.
Yeah, happy.
Yeah. Exactly. So there's no proclamation that this is curing your arthritis, when we know arthritis is just a gray hair syndrome. It's just a process of life, a casualty of living, so to speak. But it lowers that volume that I tell every patient. It has the potential to lower the volume of this bad song. And if you feel relief, then there you have it. So for the cream, a lot of athletes, people with chronic joint pain, and I always say it may not work, but you've tried. You're doing everything you're doing, and again, if it adds, good for you.
I mean, one of the funny things about CBD is. Let's, for example, you take a Percocet for pain. Okay, you have a fairly rapid response. CBD is funny because you take it and you're like, is this working? And then 4 days later or 3 days later, you realize, wow, this is really working. It's more gradual.
And let's say you have been taking it for some extensive period of time, and you go on holiday somewhere and you forget it. You're like, I didn't sleep as well as I have, or I'm a little achy.
Can I tell you? I've noticed
when you're not taking it and you have been taking it. And again, we agree, there's no dependency, there's no addictive properties to it. But if the light is too bright and it's too much, CBD lowers it. If it's not bright enough,
it brightens it. To explain it.
The word they use is homeostasis, which it's balance, and it allows the systems to work a little bit better. It's just creating a little bit better balance. The word we use is homeostasis in the receptors of our brain and in our periphery, where they can communicate to function as designed.
I mean, none of this stuff is, it's not miraculous in that you're not going to take it and have your pain go from 10 out of 10 to 0. But, honestly, opioids, unless you take a large amount, which has its own adverse effects, they don't do that. Gabapentin, all these things, what we're looking for is improving quality of life and decreasing pain. You're not going to get to 0 out of 10 with any of these modalities. 10 out of 10. So,
and in regards to the FDA approval, they have a FDA approved CBD for 2 applications. One is treatment of adolescents with seizures and treatment of chemotherapy or radiation patients with malaise. So we do already have 2 FDA applications, but the research is ongoing. There's research in pain management. There's research in inflammation. There's research in anxiety. There's research in insomnia, and that's just the tip of the iceberg. It may come with other conditions, but right now we're not making any proclamations with CBD. We're saying, look, here it is. Inform yourself, empower yourself, try it. If there's no other adverse conditions that we're concerned about, pregnancy, for example, or certain high levels of diabetes. There are things that we always want our primary care
Right,
doctor
right.
to be part of the process to see if it is a viable option for that individual.
Are there different strengths? Like, do you have different strengths in the creams and the tinctures and the
You can take this
gummies?
one.
So we do have it. Our most popular, for example, are the gummies. So we have CBD gummies. We have 10 milligrams, and with CBD gummies, we also have 25 milligrams. And then with the Delta 8, which is a derivative of the CBD product, we too have 10 milligrams, and we have a higher dosage of 25 milligrams. And why the difference? Because sometimes patients are taking 10 milligrams over a period of time. They're getting great results, but they may also get used to that dosage, and they may go up to 15 milligrams where they'll cut 2, or they'll take a 25, cut it in half. Every individual is different over time as well.
Yeah, we can talk about Delta 8 a little later too. That's a totally different beast. It really
Yeah,
is.
I actually do take the Delta 8, and it was funny because I forget which one of you said it a little bit, a little bit earlier. You did. You might not see the effect like right away, but if you don't have it, oh my God, I get so grumpy.
So Delta 8, I would think of Delta 8 as like THC light, okay? It's THC is THC Delta 9. That's what you get from marijuana.
Okay.
So the molecule is a little different. This is extracted from hemp, but it is actually a THC-like product, but it doesn't bind to the receptors in the same manner. So it's a little weaker in its effect. So what do people use that for? And once again, this is all informational and not medical advice, but I will tell you that the biggest use for Delta 8 has been for sleep. We have a lot of medications that are out there for sleep. Pretty much all of them either addictive or have other potential side effects. And even the ones we think of are benign, like Benadryl, cause falls and hip fractures and car accidents and things such as that. And if you look at the over-the-counter stuff, it's got one of two things in it, right? It's going to either have Benadryl or melatonin in it.
Right.
Melatonin, if it works, is fabulous. It's non-addictive, doesn't work for most people. Benadryl has more side effects than we really talk about or think about. I always tell my patients, be very careful with Benadryl because there have been studies that have shown that there's a very high incidence of falls and car accidents. Even if you feel sharp in the morning, you're probably not. Especially if you're over 65, you have to be extremely cautious with
tricky med.
Benadryl.
Yeah.
It's very tricky. In fact, it's one of these meds that we've almost outlawed in nursing homes because
Really?
of those side effects. Anyway, Delta 8 is a weak form of THC Delta 9. It's just the molecule's a little different. And it really seems that a lot of patients use it for insomnia. And I guess one of the beauties of it is that it's non-addictive. Now, I will say, if you take enough Delta 8, you're going to have a similar effect to THC Delta 9. So it can give you those psychoactive effects that maybe you don't want to experience. So that you have to keep in mind.
And then whenever we do recommend a Delta 8, we always tell them there are some precautions when you do take that you must be in acknowledgement of and in awareness of, is that we don't recommend them, drive immediately after they take it. We don't recommend that they operate heavy machinery. So we give them all the precautions. Better to err on the side of
You
caution.
gotta be careful. Yeah, you have to say all that.
And we do recommend that they only take it at night for those reasons. And again, one of its biggest application is for insomnia. So intuitively, you would want to take it about
before you go to bed.
30 minutes right before you go to bed, where it has
Yeah.
enough time
Right.
to enter the blood system to have its efficacy.
Primacare is Southeastern New England's trusted leader in medical care. With offices in Fall River and surrounding communities, we're dedicated to your well-being. Our carefully selected team of more than 150 providers offers world-class primary and specialty medical care. Primacare doctors are supported by a skilled staff trained to deliver comprehensive radiology, imaging, and testing services. Primacare is large enough to take care of all your medical needs, but small enough to care for you personally. Primacare is by your side.
So where it's THC like, will you test positive if you're
Yes.
going for a new job or a
You
drug
will.
test or something like
So
that?
there's a couple precautions with Delta 8. One is if you get, although it's federally legal, you still have to be careful because it will show up positive as basically marijuana on a drug test. And there are a number of employers out there who look at that, and it's important to their employment that you have a negative drug test. If you have a federal job, if you have a trucking job, you don't
CDL license.
You want to stay away from this.
Does it stay in your system a long time?
It's the same as with marijuana,
Anything else?
weeks to a month. Yeah.
30 days.
But I guess for a government job, my daughter-in-law to be has hair down to here. She went to apply for a company that has government contracts. They plucked her hair out at the roots.
It's a way to test.
like,
It's a way to do drug testing.
Yes.
That's very common.
So you just have to have that knowledge.
Yeah,
before
you have to have knowledge.
But we inform them. And,
Yes.
Again, when we talk about CBD or Delta 8, there's conversation. So it's not on day one, I may recommend. I have a relationship with the patient. They've been with me, and I only want to incorporate that when other things have failed. So we also can talk about their job. In itself, we talk about ergonomics. And so when we talk about the Delta 8, we inform them that, do you get tested, or is there any concerns, or do you have any questions? So we try to, empower them with as much information regarding that.
And many patients have, tried lorazepam, and they've tried Ambien, and they've tried all these other products, and they haven't worked. And, it's another tool in the toolbox that if you have terrible insomnia, you can try. But I would also say that for insomnia, there's a lot of cognitive behavioral modification. It's I don't think insomnia is something you should just throw a drug at.
Yeah.
Because there's reasons that people don't sleep. And there's something called sleep hygiene. Are you going to bed and watching TV, or are you on your tablet? How much coffee or caffeine are you having? Are you drinking significant amounts of alcohol? All of this disrupts sleep. So you have to look at the big picture, and it's not just all about, hey, here's something else you can try.
And we're not proclaiming this to be the magic one-all, fix-all, one tool in this box. But I do want to say one thing in the sense that for those that have been utilizing, for example, the Delta 8 for better management of their insomnia, they're all repeat customers. So there has to be something to that in that, Dr. Jonkis and I, we've been at this for, almost 3 years. And we see the log. They are repeat customers almost once a month or once every 2 months. They're coming back, and it's a very positive feedback we're getting from them. Like, I'm not here to say this. They're saying this is the only thing that helps, but they're excited about something that is natural by all definition, and it's helping. It's working.
Yeah, well, I think what people like is they wake up in the morning and they don't have a hangover effect too, and they sleep well.
Yeah,
and that's a big part of it, because almost everything else, you feel a little, logy in the morning. So Delta 8 is federally legal, as is CBD, but there are some states where it's illegal, and that's important to know. So if you are considering CBD or Delta 8, look at your state laws. CBD is legal in almost every state in the nation. There are some outliers. Mass and Rhode Island are fine. Delta 8 is legal in Mass, actually not legal in Rhode Island.
But
so keep that in mind.
For our company, we do not sell any product unless you're 21 years or older. Right. So that's first and foremost, even though in many states it's 18. Right. But Dr. Jonkis, we've made a proclamation that though it may be, we personally have taken upon ourselves to say that we do not sell.
We try to be very conservative with it.
Yeah. So it comes that point that you made is pretty important if you're traveling. You don't want to go fly into a state that you're going to be in.
Well, that's these are the things you have to think about with all of these products, really, And the same thing with, if you're traveling with opioids, or, people will get letters from their doctors to say, hey, I'm on this for a medical reason. You don't want to be stopped by TSA with some, a bottle of Percocet or in a little baggie, even worse, without your name.
So now this is all over the counter. None of this is prescription.
That's correct.
These are not prescription. I mean, you can buy CBD at one point at CVS. You can buy it at 7-Eleven. But, Dr. Jonkis will, elaborate on this. We're different than
I was going to ask that. What makes you different from a gas station?
Well, I can say this. Every one of our products, we get it third-party tested. We get it tested for its potency. If it's 10 milligrams, it's 10 milligrams, and its purity. And also, we also have a spreadsheet of it can't have any of these toxins. It doesn't have
Nice.
any of these.
That's pretty
That's exactly right.
Yeah, hemp can absorb a lot of heavy metals and toxins from the earth, so you have to be careful, because if you get a product that's not tested, you really don't know what you're ingesting. So you have to be a little cautious.
And we
with
take
that.
pride in that. In that the fact that every product that we have is third party tested by an independent lab to say these variables. Yes, we have X, Y, Z, and no, we do not have ABC. So we take pride in that.
Yeah.
Now you have these products available at your office on Ellsbury Street in Fall River.
Yes.
Now, does someone have to be one of your patients
Not at
to
all.
go in
No.
there? They
Nope.
can go in and go into.
Ironically, it's majority are not, and it's a grassroots operation in that you're feeling good for whatever reason you're taking it. You may tell your sister, you may tell your 82-year-old mother, I'm not saying you individually, but to say, look, Mom, try it. It's worked for me, and you'll be surprised how many repeat customers we're getting and how many patients or clients or customers we're getting for pre-existing patients to say it's worked for them, and that's the best billboard you get.
We get a lot of patients who buy it online too, because they're out of state. They're in Georgia or they're in North Carolina or wherever it may be. And I don't even know how they found us sometimes, but they did.
Well, we are a medical company. So for that reason in itself, understanding the method of our testing, our purity, that creates a little separation from many other companies that are out there.
And you feel safe buying a product like that, and the website advancedmedical.com.
Advanced Medical CBD.
Yeah.
Advanced Medical CBD.
Yeah, so there's a lot of little videos and information on there that if our viewers are interested and they want to take a look at that, there's some more information that they may find on specific conditions. They're wondering about their pets or whatever it may be.
Nice. So you mentioned the four-legged creatures.
Yeah.
Can we talk a little bit about that?
Here's a funny thing. I was at an airport and there was not a kiosk, but like a vending machine on CBD for animals. And, it's like when dogs hits thunder, they're angst, they have anxiety or whatever. So, pet owners will provide CBD for their pets under those pretexts, or when the pet is traveling. But in a further application, pets too have. I had a 15-year-old chocolate lab and had severe hip pain,
Arthritic.
and it was the vet who said, "Did you ever think about giving it CBD just to reduce some of the pain that the?" Now I'm not communicating with the dog saying, "Hey, buddy, are you feeling better?"
Yeah.
But you knew to some degree it was providing some inherent comfort. So, absolutely. I mean,
it's actually harder with dogs, right? Because animals, pets
Yes.
in general, they can't tell us what's hurting. All of a sudden, you notice, well, they're not as active. They're maybe a little gimpy. They have pain, and like my dog was just diagnosed with Lyme disease, and for like a month, he didn't seem the same. I thought he was just aging. He had a little hip pain and that. And then I said, let's bring him to the vet, and get him checked for Lyme because we have deer all over the area, and he was positive. And he's on antibiotics, and within like a week, he was like a new animal. But a lot of people are using the products for pain with their animals and also for anxiety. A lot of dogs in particular suffer from anxiety.
Is a product made different when it's for a dog versus a human?
No, it's the same chemical, but it's in a doggy biscuit with the flavors that the
or
dog
a
would like.
kebab or a meat kebab.
Yeah, so
or
it's probably not a flavor you would enjoy or I would enjoy, but dogs seem to like it.
I don't know. My dog seems to like anything. Gosh,
Yeah.
they tear up cough drops when I came home today. I'm like, oh, Jasmine.
And some pet owners also there's pet tinctures as well that they give their
do
cat
that
or
too.
their dogs as well.
It's just easy to give them a
treat.
treat, so to speak.
So are there any contraindications? Like you had mentioned pregnancy and that you don't sell to people below 21, but other medical contraindications?
There are some medication interactions that are potential that are really unlikely, but we discuss this with patients just so they're aware. So, for example, if someone is on certain medications, let's say cholesterol-lowering medications, statins, for example, then there's a potential interaction with CBD. I think that it's unlikely to be an issue, but this is why I always say talk to your healthcare provider, see if it's safe for you to take it. With statins, for example, there's this interaction with grapefruit, right? I mean, lots of people have
With lots of
statins and
meds,
grapefruit
yeah.
and they're fine, but you will have the occasional patient where the levels will increase and they'll have terrible muscle aches and that. So you do have to be aware of this. I would never give it to anyone who is pregnant. Because I don't like to give anything that is, alien or any
External,
chemical
yeah.
external to a pregnant woman. If someone had really severe liver disease, cirrhosis and end-stage liver disease, I would.
And
I would
Nancy,
have
to your
caution,
point,
but
I mean,
for the most part, not a lot of contraindications.
And again, with all this research that's coming out, we're going to get more informed to say, now we have a patient base of 1,000 patients, and of that, a certain percentage did have. So the research is coming. So we're going to be more informed as time progresses, where we're going to have bigger patient base. We're going to have more. We're following up a year after the fact that they've been using it. 3 years after the fact. So these studies are coming out. So we're better informed that this is an evolving healthcare process.
So most of the studies that have been done weren't done in the United States because, for many years this has been illegal, right?
Right.
Because kind of hemp-based products were thrown in the same category as marijuana. Marijuana is still federally illegal. That's why you have to go to a dispensary for it. So for that, it's hard to do studies on some of this stuff,
Right.
But a lot of studies have come out of Canada, out of Europe. Israel has done a lot of studies, interestingly, on medical marijuana and, CBD and that. And I think as time goes on, now that it's legal in the U.S., CBD, that is, we'll see more studies.
And better opportunity to answer all these questions. And then we'll be informed to relate to the patient to say, hey, there is a risk of X. There's not a risk. It doesn't affect the kidney. It doesn't affect the liver, if that were to be the case, as these studies come out.
Now, you had mentioned that you've seen some great outcomes. Can you talk about some of the outcomes that you've seen that have maybe surprised you? And you're like, wow.
Well,
This worked really well.
I mean,
for
in
this
general, I don't want
particular
to,
patient.
release any information about a particular patient, but, I'll give you an example. I had a patient who was on chronic opioid therapy for many, many years because of let's say an accident and some severe trauma that occurred. And, the problem with the opioids are, you try to keep the level the same, but, eventually you have to go up a little and you go up a little more. And, you do this over 10 years and then, the patient's on a fairly significant level of medication. They're going to the pain clinic too. Then this particular patient, this was one of a couple, similarly, used CBD on their own and had a pretty remarkable decrease in their pain. Now, they still remained on opioids, but their quality of life was much improved. And that was the key aspect to me that really was notable.
I'm fortunate in the sense that all of my patients have some sort of inherent pain syndrome, whether it's low back pain, sciatica, neck pain, myofascial joint pain. So again, not everybody, but when you ask me what was unexpected is that when I start incorporating CBD, whether it's the topical cream, maybe it's more of a palliative approach. It's just making them feel better for that moment in time or for however long it may last, whether it's for the day or for a few hours. I'm getting that feedback that it's improving their quality of life. And then secondly, with the continuous, with whether it's the gummies or the tinctures, they're with the dial is lower. I'm seeing that more and more. And then there are rogue patients that said, I had a lot of skin inflammation or irritation. Then I started taking CBD and it helped. But I'm not proclaiming, for your eczema, take CBD.
Right.
It's just they're telling me that.
Right.
Or their stomach irritability and they started taking CBD. And it says, you know what? It's not as prolific as it once was.
Right.
I'm not proclaiming that this is going to help with your GI disturbance, but they're giving me these feedback of the their GI may be inflammation, and we
Right.
agreed
It's not
that-
the main thing we recommend for, but you do see these kind of anecdotal type things that occur. And usually it's a patient who just tries it on their own because we're not generally recommending
and they're
it,
giving
but-
us the feedback.
But they come in, they say, hey, I've had chronic GI issues for years and I tried this and it worked. I don't really recommend it for that because I think there's not a lot of data yet on that. But we do have patients who have tried it on their own for whatever the ailment be, a dermatitis of some sort. Once again, I wouldn't really recommend it because, I don't have the data behind it, but patients do it on their own and they get better. I
Right.
mean,
And it has, again, we talked about homeostasis.
Yeah.
They may be taking it for their chronic joint pain or their chronic myofascial pain, and they have a better quality of sleep while they're taking it, or they're not as angst as they was. Maybe because they're in less pain,
Yeah.
globally speaking.
Right.
That'll make me happier.
I think the
Absolutely.
majority of what I recommend it for is pain issues, anxiety issues, and sleep issues. Those I would say.
And some inflammation for me.
Yeah.
I say, don't stop your Motrin, don't stop your NSAIDs, don't stop your Meloxicam, whatever it is that you're taking. But if it helps, continue onward.
So it sounds like a supplemental therapy. You
It's
Or
an
adjunctive.
It's an adjunct,
Yeah.
and some people derive a lot of benefit from it, and they'll even be able to maybe decrease some of their other therapies, and others it'll just be an add-on.
And there's some patients that have no benefit.
Yeah, that does happen
and that's part of the conversation. I say, look, it may not do anything for you, and that's okay because the risk is very minimal with regards to any horrific side effect.
But I do say if you're going to try it, give it a good 30 days. Because
Nice.
you can't do it for 3 days and decide that it doesn't work.
Right.
It doesn't really work that way. It takes a little while.
Great point.
So if I'm thinking about it, but I want to have an extended conversation, that's one thing that I liked about walking into your clinic is, you have that time to talk and ask questions. And so people can see you or they can contact you.
I'm there. I try to navigate the best outcomes I can. So we're there, Monday through Friday, some Saturdays we're there to help, engage and to inform and to empower them to say, first and foremost, if they're there, something must be within them to say, I'm open to the idea.
Right.
And then I just give them the opportunity to understand their different options, to inform them my experience of what I've seen, what I've read, what Dr. Jonkis and other colleagues have utilized, how it's helped their patients.
Mm-hmm.
And then it allows them to make an informed decision. And you'll be surprised, majority of them will say, let me at least try.
Mm-hmm.
And fast forward, they come back.
Yeah. That's great.
I mean, the downside is, none of these therapies are paid for by insurance companies. Unfortunately,
So
same
is
with
it-
medical marijuana, it's not covered. We try to keep the price very competitive. And there, I'm sure there are cheaper products, but they're probably products that aren't being tested in third-party
You have to
labs
take the
and all
quality
of that.
into account.
Exactly.
There are some differences between the gummies and the tinctures I'll mention as far as the onset of action. And this is important to know. Gummies, it tends to be very, the absorption is very dependent on what's in your stomach at the time. Okay.
Oh.
It takes at least, I tell people to take it about an hour before they, expect to see any effect. So if they're taking Delta 8 for sleep, take it an hour before. But, if they have had a big meal, they may not notice that effect
Right.
for many hours, which is interesting.
Oh,
And
good point.
it can really delay the effect. Tinctures, it's more immediate, I find. It gets
And that's one of the
absorbed.
reasons why we recommend it at night.
Yeah,
you
it gets
know?
absorbed pretty quickly. The gummies are a little bit, it's variable. It really depends on the person and what's in their stomach and, a lot of factors. So you got to give it a little more time sometimes.
Is it just the gummies that you have for sleep?
For sleep, some people just use CBD for sleep, and,
Okay.
it works for some patients. Some patients go to Delta 8, and that's only in gummy form.
Mm-hmm.
But there are other, and we are, as we're growing as well, we may start utilizing chocolates. It's just a different
Could
flavor.
you do that tomorrow, please?
So, again, as CBD is, with more research, more applications, that they're going to find different they're going to be in foods. They're going to be in drinks.
Right.
I think Pepsi is working on a CBD drink.
That's cool.
So it can be incorporated in different avenues.
Right.
Fantastic. Now, is there one last message you'd like to state to our audience?
You can start. Go ahead, Rush.
I'm really excited about CBD. We started this about 3 years ago, and I really feel a sense of purpose that we are providing a means for our patients here in our community to say, hey, there is some hope. And for that, you feel a sense of fulfillment that you are clearly changing elements within their lives. And for that reason, it's really, we're excited about more things we're going to be doing.
Yeah. I think, for me, it's a great option. We all have a toolbox we work from, and it's another tool that we've added to the toolbox to try to help people with whatever their issue may be, whether it be anxiety or pain or insomnia. I'm excited by the fact that the side effects are really, really quite minimal. I'm excited to know that there'll be more studies and more data as time goes on, because I think everything we do should be data driven. And I'm excited by the absence of side effects for most of these meds.
No, and the feedback, and it's creating a community as well. People are the patients that are coming back, they're having further conversations and saying, wow, it's done XYZ. It's really, it's really allowed me to do more. I'm playing golf, I'm dancing, or whatever it is that they're doing.
Be. Right. So if you're interested in learning more, Dr. Nehra is, always at the office. He's very willing to.
I'm a prisoner to my my duty to my patient.
To talk to you about it. And the address for the office.
So it's 415 Ellsbury Street. It's right across the brand new, beautiful Durfee.
Yeah.
We're there Monday through Friday. The first Saturday of every month. But, we're available. If you know in advance you want to come and speak to myself or one of my assistants, we're readily available just to kind of educate you.
And I would also say on the website, there's a lot of good information, as I mentioned previously. There's some short videos you can watch. You can order on the website if you don't want to go down to the store. And that can be found at advancedmedicalcbd.com. Once again, talk to your healthcare provider. I just want to stress, as with all of our discussions, this is informational and it's not medical advice, but we are still, that being said, very excited by the products and, what it can do for some patients.
Great. Thank you so much.
Thank you.
All right. Well, as we wrap up, this was a little different because I'm actually a guest and
I know.
so weird.
I know.
Anyway. So once again, thank you everyone for listening in today. I want to thank our guest, Dr. Rajiv Nehra.
Thank you for having me. I appreciate the opportunity.
Good friend of mine, and who is just a wonderful chiropractor. And I want to thank, of course, Bay Coast Bank. Bay Coast Bank supports these efforts, and we're really appreciative of that. Bay Coast Bank is just right for all of your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. And remember, follow us, please, on Facebook, Instagram, your favorite podcast platform. And if you have any questions, certainly feel free to reach out to us. And thanks again for watching The 27th Degree with Chris and Nancy.
Thank you.